Why do we need a clinical standard of care? Well, when we have a clinical standard of care, everyone on the team understands it. So if a patient comes in with these symptoms, they qualify for these services. So it's not one person making that decision, it's the clinical standard of care making the decision for the practice and whoever's in that position. And it's a great training mechanism for a new employee coming on to learn about your protocols, to learn about your clinical standard of care. So now, if there is a question about what that patient needs, you go back to the clinical standard of care and say, this is what the clinical standard of care says. And if you need to edit it, update it, delete it, you can do that, but it's something that everyone can focus on, so the decision isn't on one person, it's around a standard. And then, do you have a process to gain referrals in your practice? Do you have referral programs? You need a referral program. You should have a tool or a guide on how to do this in your practice for your office manager to go off of. Do you have instruction on how to get testimonials? Do you have a system and process documented on how to get testimonials in your practice? Very important to get social proof from your practice.